You're listening to The Local Lens from the Powell County Health Department.
Nobody wants to be an addict. That's not the life. Have you ever heard a child say, when I grow up, I want to be an addict? That doesn't happen. Nobody wants to be an addict. So if they don't want to be, they would stop. But they need some assistance to help them stop. I know that there's no data, there's no scientific evidence to say that 90% of my crime is directly related to drug use. But I know this. It is. It's somebody that's stealing to support their habit. It's somebody that's high that's breaking into somebody else's house. It's somebody that is addicted, that can't control their emotions, that hits their spouse. All this is directly related. That's the cause of the crime. Not the cause of their problem, but the cause of the crime. So if they can't quit on their own, and it's my job to help the community by cutting down on some of the crime, if I can help them get off the drugs, then it also makes a decline drop in the crime.
That is Rob Williams from the Clay City Police Department, and he is our guest on this week's episode of The Local Lens, the podcast from the Powell County Health Department and Kentucky Rio. And this is the show where we go inside our community's experience with the drug epidemic by having deep, honest, and intentional conversations with people that all have their own unique perspective on addiction. This week's guest, Rob Williams, has been serving in police departments since the year that Bruce Springsteen's Born in the USA album came out. So he has such a long history of dealing with this secondhand through his professional role. And he comes on the show to share how his views have changed over the course of this time. And now what you have today is somebody who really seems to value being proactive as a way to solve issues and to make things better. You're going to hear a theme through what he's talking about of going up to the root causes of issues that we all face here. So keep your eyes out for that. Let's go on and get into the interview. I'm your host, Nate Brooks. These are our people using our voices, telling our stories, because no one sees it like we do.
I'm Rob Williams. I'm the police chief in Clay City, Kentucky.
How long have you been there?
I've been in Clay City for 3 years now.
For 3 years? Welcome to town.
Yes.
And where are you from originally?
I was born and raised in Lexington.
Okay. You were in Lexington up until you came to Clay City?
Well, actually, I started my law enforcement career in 1984 in Harrodsburg. Then I moved back home to Lexington in 1988. I retired from Lexington. I went to Paris, Kentucky as the chief over there for 6 years. I retired again, came to Powell County, and they talked me into coming back to work up here.
You're coming in as an outsider then into Powell County. Have there been any other surprises stepping into, any surprises at all, like stepping into working in Clay City that is starkly different from Lexington?
It's quite a bit different.
Yeah.
I mean, you have a lot of the same problems, but even though I worked narcotics some in Lexington for a while, it was a different set of problems, different. Here, in a small county, any small county, people are related, people know each other. So it seemed to have a greater effect on the community than somewhere like Lexington. If you had an overdose, it was a statistic. That was it. But here, everybody's talking about, so-and-so either overdosed or passed away from an overdose, and it affects the whole community. Williams
certainly hasn't been in town as long as many of our other officers, but he has done a lot in the short time that he's been here to help us develop how we are able to respond to overdose calls. Along with Shauna Stanton from the Powell County EMS, Williams has helped get OD mapping off the ground in Powell County, which is a tool that does pretty much exactly what it sounds like. It helps map out where overdoses are occurring at. What is it about OD maps, that overdose maps, that you really thought was important enough to get started?
Well, one thing about, we have 4 law enforcement agencies in Powell County. A lot of times we don't know what the other does. and we just kept noticing we were having a lot of overdoses, but some I wasn't hearing about for 3 or 4 months even. So the OD mapping was brought up by a member of VMS, said this was out there, so I looked into it, and it's basically real time. As soon as you put it in, I can look on the map and see. So, every morning I can look up and see if we've had an overdose in Powell County.
And I'm sure you check it pretty often now.
I do. I check it at least once a day.
How long have we been doing it here now? It's November 1st of 2021.
We actually have only been up and running, I'm going to guess, about a month.
What have you seen over the month?
It's. I'd like to have a little more data, but from what we've seen, it does seem to spike toward the first of the month. And that is what we expected.
Yeah.
I mean, that's when checks come out and people get some money, and so the overdoses do seem to spike around the first of the month.
Since we have met, I've noticed that you have a very tactical kind of passion about doing something about this.
Yes.
Where has this come from?
Well, I've been in law enforcement for 37 years. For the first, I'm going to guess, 15 years, I was like most of the population looking at an addict. If you really want to stop, just stop. If that's not what you want to do, just stop. Just like any other habit, bad habit that humans do, overeating. If you want to stop, you can go on a diet and do whatever. It wasn't until I went to the Department of Justice put on a training in Gatlinburg for narcotics. I attended this training, and there was a surgeon there, and I wished I could remember his name, but I can't right now. But he was an addict, and he said that he had been an addict since he was 8 years old, started out with Ritalin, and he was still addicted to Ritalin up into his 30s and 40s. But then that, it progressed, and he started taking Oxycontins was his drug of choice. He started explaining what the narcotics do to the brain. So, and one thing he talked about was in 1954 they did a study on rats, and basically they were trying to show that a negative would cause them to do a positive. What they didn't know, they hit the wrong part of the brain, and they hit the reward center, so even though it was a shock, it was giving them a feeling of reward and pleasure. So they were doing exactly the opposite of what they were trying to train them to do.
So when you say they hit a negative, seeing if they would do a positive, what do you mean by that exactly?
Basically what they meant to hit was the back part of the brain, and if they applied a shock when they turned left, then they was hoping it would start a habit of them going right, and that would be a learned habit.
But they liked the shock.
They liked the shock. It gave them a feeling of reward or pleasure, and so they kept continuously going left. It wasn't until they actually took an x-ray and saw that the electrode they had put in the rat was in the wrong place. So then they started doing experiments on, they called it a pleasure center, they call it a reward center now, part of the brain. And some of the findings that they found was that, and they allowed the rat to apply the shock or the stimulus themselves by putting a lever in the cage with them. They found that mother rats would sit there and hit the lever up to 7,000 times an hour, and she would ignore the babies, wouldn't feed them, she wouldn't eat herself, she wouldn't clean herself, she would just sit there and hit that lever. They put male rats in with a female rat in heat. He would totally ignore that female rat and go over and hit that lever. They would put electric shock pads on the floor of the cage on the opposite side of the lever. The rats would go through that shock pads to get to that lever. So they translated that into, this is basically what narcotics do to your brain. it reinforces things. That's the only pleasure you get. And I always tell people, and it's very simple way to put it, but if you go outside and it's 20 degrees and you get freezing cold, you come inside, sit down by the fire, that feels really good. That is a pleasure we've learned. We know that warm when you're cold feels good. If your brain has been used to the narcotic providing that, they don't feel that warmth. They don't feel that pleasure by sitting by a fire even though they're freezing cold. So it does rewire your brain to actually reward, like for a better word, negative behavior. That drug use is the only way that they can feel pleasure. And just like the rats, they will do anything to hit that lever or get that drug.
So my first response to hearing about this rat experiment is that we are not rats. We don't think the same way that rats do, but you can see how this logic applies to drug usage. When you start to consider how dopamine works and how it is released, it is pretty clear to see how somebody could continue to wreck their system, especially over long term, how somebody could wreck their system pursuing this incredible dopamine release and feel really good from it. Something else that comes to mind, though, after this is another experiment about rats. This is one commonly called Rat Park, and the gist of this experiment is to see if rats will choose either being social or doing drugs. This experiment, in a nutshell, goes to show that if a rat has nothing else to do, then they will partake in some drug usage, even to the detriment of their own health and their own life eventually. But if you present a rat with the option to be social and interact with other rats, or to do other things that rats find as inherently enjoyable, then the rat will choose to do those things instead of drugs. But there are some big differences between these two experiments that mainly have to do with how the rat was exposed to the shock or the drug in the first place.
With the electrodes placed, they didn't have a choice. I mean, they were hitting that. They had a choice to go, and it is a learned behavior. Most things are. We don't grow up, we're not born with this feels good, this doesn't. And that's why they say, once an addict, like if 10 years down the road, they go back to an old neighborhood where they used to do drugs, that craving will start again because it was a learned behavior, and that is bringing up a memory that's telling its brain that felt really good when they did drugs.
So just to bookend this bit about the experiment, I would like to clarify that we are not the scientists that ran these experiments. That is neither one of our expertise fields, but it is a helpful way to start looking at addiction, and it can kind of teach you how to see it from a new light.
Like I used to say, just stop if you want to. It's not that simple. And they do need help. They do need reinforcement from other people, because if you ever heard an addict say, I can stop on my own, no, they can't. And most of them, and that's what I hear a lot, I don't have a problem, I can stop anytime I want to. Nobody wants to be an addict. That's not the life. Have you ever heard a child say, when I grow up I want to be an addict? That doesn't happen. Nobody wants to be an addict. So if they don't want to be, they would stop, but they need some assistance to help them stop.
So you heard this from the Department of Justice. How did knowing that then influence your work as a policeman?
Well, actually, that's when I started looking at addiction in a different light. Knowing that they couldn't just turn it off, they couldn't just stop. I know that there's no data, there's no scientific evidence to say that 90% of my crime is directly related to drug use. But I know this. It is. It's somebody that's stealing to support their habit. It's somebody that's high that's breaking into somebody else's house. It's somebody that is addicted, that can't control their emotions, that hits their spouse. All this is directly related. the cause of the crime, not the cause of their problem, but the cause of the crime.
Mm-hmm.
So if they can't quit on their own, and it's my job to, help the community by cutting down on some of the crime, if I can help them get off the drugs, then it also makes a decline drop in the crime.
To be blunt with you, this seems like a more effective approach, entirely a more proactive approach to cutting down on the crime that we see here. If you're looking at the big picture of crime and pretty much all of it has the same backbone of drug abuse, then the best way to curb your crime is to curb the drug abuse. By addressing drug abuse and getting people into addiction services head on, then you're addressing the crime issue from at least a little bit closer to the true source of the crime. So the police are involved in this because of the general public's safety, but they're also there for the drug users' safety as well.
With all the fentanyl and other stuff, I know a while back I got some stuff that was fentanyl, carfentanil, heroin, meth, and hydrocodone mixed.
Oh.
So you don't know what you're buying.
Mm-hmm.
And all it takes is one time and somebody not to be around. And I mean, we've all heard about Narcan bringing people back. Well, Narcan doesn't work on meth, and it is true, and they will tell you, they'll say nobody ever overdoses on meth. You can. It's not as likely as heroin or fentanyl, but it can cause your body to shut down. So
How much
with
meth
the right
would it
mixture,
take?
it would take a lot, but still, everything that they use to make meth is poison. That if you put it in your body by itself, would kill you. Something about the compound and the way it's mixed, just lucky it doesn't kill you when you use it. But everything they use to make meth is poison.
Yeah, that's terrifying.
Yeah.
So you said you've been in the police force since the 80s?
1984.
1984. Hey, born in the USA, man.
Yeah.
I was raised on Bruce Springsteen, so it's a good thing. But how have you seen the landscape change? I know that's a huge question, but like specifically to drugs, how have you seen that change?
The biggest change, and it has been a cycle, is just what they're using.
Okay.
Back when I first started, crack and cocaine was the big drug. You didn't see heroin, you didn't see LSD, you didn't see a lot of meth. I mean, but now, and then, in the, what was it, late 90s, it was mostly pills. It was the Oxycontins, and then they set up Casper in Florida, which was our big pipeline for the pills, that cut a lot of the pills down. After that happened, it went to basically meth. But then you saw a reintroduction to heroin, which was a problem back in the early 80s. So it has been a cycle, and that's the biggest change, is just the drug of choice.
Yeah, any idea like what changes that? Is it just people respond to it and like the
price? When they did the big move on crack, I mean, you could go to prison for a long time for a couple of crack rocks. It wasn't worth it to the drug dealer, so they found a different drug. And now there's no laws about this drug that says I have to go do 10 years. So they started selling a different drug. And then we used to see a lot of meth labs. We don't see those anymore because the drug has become so cheap that it's cheaper for me to drive to Lexington or Winchester and pick up a load than it is to try to make it myself. I would spend more money trying to make it than I can go drive over there and pick up some and come back and sell it. Still not good, but it is better that we don't have the meth labs, because, like I said, everything in there is poison. If I hit a house that had a working meth lab in it, that whole thing is shut down and quarantined, basically, until you get somebody in here to professionally clean up that house.
How long has it been since like meth labs really started dropping off?
I would say meth labs started dropping off probably around 2009 or 10.
Okay.
Because, like I said, the drug just became so prevalent here and easy to get, and most of that comes from Mexico. So.
And then not long after that was probably when fentanyl started coming into the play. Is there any connection there, do you think, or?
Well, no. The fentanyl is a synthetic.
Yeah.
It's man-made. Heroin, they're both opioids, but fentanyl is actually 50 to 100 times stronger than morphine. It's cheaper than heroin, so they figured out if I can use the cheaper stuff to cut the heroin with, I can make more money. But the problem is, you got to know how much fentanyl to put in the heroin. And truthfully, I wouldn't trust somebody that is high most of the time to figure out how much goes in what. And that's where, and even the mixture, I mean, if they just dump a scoop in and then a scoop on top and it doesn't get mixed up, if the fentanyl's on top and you take out some to shoot, you're getting raw fentanyl, and that's where a lot of people are overdosing and dying.
What would you say is like one of the big misconceptions about like either the entire like drug scene at all, or like the police's involvement with it? What's like a frustrating misconception that you've seen?
A misconception. Well, I mean, like I've already talked about, the normal citizen will look at an addict and say, and initially, yes, it was their choice to start using the drug. Well, no, I take that back. I've seen a lot of good people get hurt or be in a wreck and be prescribed opioids for painkillers and get hooked on it. So it's not all by their own choice. Now, some of them are, but there are cases, a lot of cases where it's not. But once they're addicted, they have to have more and more because your body will build up a tolerance to it. Now, I understand more about, how it affects you, but I think the general population does have a misconception, like I used to. If they wanted to quit, they would quit. I don't feel sorry for them. And not saying that I feel sorry for them, but I'm trying to get them some kind of help, because it does affect the whole community, whether it be crime. And that person that's an addict is somebody's mother, father, brother, sister. Somebody cares about that person. So, and it is a tragedy, to lose somebody in your family. And if it's ever happened to somebody in your family, you know what I'm talking about. And they look at it and say, well, what a waste. Yeah, it probably was a waste. But was there a way that we could get to them and try to get them off that drug?
Well, thank you for your answer on that. So then the other one is, and I think this is my last question, are there any changes that you think we need to make as a whole group of people to approaching, like, finding a solution to this?
Well, there are, I don't think there's a one-stop shop, one-size-fits-all solution to it. There are things that you have to change the perception of the community towards addicts, because once they do get clean, if they've been arrested, for possession, it's hard for them to get a job, even if they're trying to turn their life around. And we need some people in the community to step up and say, I'll take a chance, and give them a job, let them prove that, if it doesn't work out, or, you can always get rid of them. But that to me is the biggest problem. Once they have that felony record, it's hard for them to get a job. And even if they've been clean for 3 or 4 years, I mean, that felony follows you forever. So as a community, if some businesses could step up and say, we'll take a chance on some of these people and try to get them back on the right track, that would help a lot. Because yourself, if you're trying and you're trying and you're trying and you can't support yourself, and it's going to lead you to depression and back down the road to abuse.
So this is 2021, right? At the end of 2021.
Yes.
Last summer, we saw a huge, people were calling for police to change everything about how that works. And I think mainly the most interesting part of that to me was with having mental health workers as a part of law enforcement. Do you have any thoughts on that? You've been in the police your entire career, so how do you see all that?
Well, there's definitely a need for mental health workers. Like I said, the drug problem here is conservatively 90% of my problems. Even though some of them are, offshoots of thefts and domestic violence and burglaries and stuff like that, it still falls back on the drug problem. Without them getting some mental health help, they're going to stay in that cycle, and it's going to cause my crime to stay the same. So yeah, I definitely think there's a big role for mental health workers to play, in helping these people.
So moving into our final statements here, I asked Rob how he suggested we could change our approach as a community to addressing this huge issue that we're facing.
One thing I would like to touch on, I know we have a group in Clay City that are trying to work on creating a homeless shelter, because we do have quite a few homeless, and that's all well and great. I believe we've got a food card program. I hand out free meals to somebody that really needs it. They do meals down there, and I know they're wanting to start a homeless shelter. That's great also, but I wish they would more look into starting a in-house treatment facility, because we can give them all the food, we can give them a bed, but it's still not treating their problem, the root of their problem. They have to come in, they have to get some mental health professional help. They need to get a support system set up. And even though we can still do all the other things with the food and the beds and stuff like that, if somebody has the opportunity to start an in-treatment facility, to me, that would be more beneficial.
So let's consider that to be a charge for our community and other communities like ours to be more proactive. Instead of focusing on Band-Aids and how can you do immediate solutions, go up the stream, try to get as close to the root of the problem as you can. Now, Band-Aids are still incredibly important though, and they are necessary in a lot of situations, but our response to this opioid crisis cannot just be a bunch of Band-Aids all stacked on top of each other. At some point, we have to get to the root of this issue. And that's going to be a big theme for several of our upcoming episodes. We've spent a lot of time trying to understand addiction more. We've looked at the science, we've looked at how many people it affects. So now we want to start being more proactive and talking about solutions. So thank you for tuning into The Local Lens. We really appreciate you guys listening to us. We hope that you keep coming back and hear more about what some of the solutions to this huge issue might be. I would like to thank a few people before we sign off here. First of all, to Rob Williams, thank you for coming on the show and answering all of our questions with as much honesty as you did. We really appreciate that. It's very insightful for us. Second, I'd like to thank the Powell County Health Department for starting the show and Kentucky Rio for continuing to fund our show. And also a big thanks to WSKV out of Stanton, Kentucky for helping us broadcast. You've been listening to The Local Lens. These are our people using our voices, telling our stories, because no one sees it like we do.